Hello, welcome back to the Teggatz Clinic. I'm Linnea. I'm the nurse and health coach here, and I have Dr. Teggatz here with me today.
Hello.
We are talking all about hypothyroidism. So we've talked about the symptoms to know if you have it. We've talked about what lab results to get to help with the diagnosis. Now I want to ask you, Dr. Teggatz, what causes hypothyroidism?
The thyroid gland is like the canary in the coal mine. So when we are exposed to chemicals and toxins in the environment, our body has to deal with those. But when it gets above our ability to detoxify and convert those toxins into something that we can excrete from our body, then the thyroid gland is kind of the first thing to be affected, as well as other hormones. So toxins in the environment are definitely something that I look at. The other thing are genetics. Most people with hypothyroidism have a family history of some kind of thyroid disease, and it doesn't really matter what kind of thyroid disease. If you have a family history of any thyroid disease, your risk for whether it's hyperthyroidism or hypothyroidism, autoimmune or not, go up. Stress is another big risk factor. Stress definitely affects all of our hormones, thyroid gland included. Your thyroid also needs certain nutrients in order to function normally. It needs the amino acid tyrosine, B vitamins, vitamin D, omega-3s, iodine. Iodine is super important. The main source of iodine for most people is table salt. So first you need to be eating those foods, and then you need a gut that is functioning well and absorbing the nutrients from your food in order to have the things necessary for your thyroid gland to make thyroid hormone. Infections, notably viral infections, but other infections as well can affect your thyroid.
Well, that wraps up today for hypothyroidism, and we will be back for one more time to dig a little bit deeper.